digital health and the unleashing the power of data at the heart of our health system are absolutely essential for that challenge.
The key thing about digital solutions is they've got to be connected into the health service, so that when you're making choices about your own healthcare, your healthcare professionals, your doctors, your nurses, your pharmacists are able to be connected and are able to give you more options and be able to sensitise the information they're giving, you're taking from them through the digital medium.
Human beings cannot manage without some sort of technical assistance, and it's just getting worse. The complexity of medicine is just getting greater and greater, and the demand is also getting greater. So we need IT.
My view is don't try and change the science or the medicine. There's highly skilled people who provide that. What technology gives is a new way of interacting. So two examples, just using telephony and video-based media to connect people enables healthcare to be more efficient. And then if you think about video on demand, so a lot of healthcare is repeated. Your advice around diabetes and someone else's advice around diabetes is pretty much the same. Well, if you can do that video on demand, you can capture the clinician once and send it to patients, so that you're building an efficiency into the system. So it's much more around efficiency in terms of interaction rather than actually changing the content of the interaction.
The main challenges I see are around changing professional behaviour, changing patient behaviour, but also providing an ecosystem so that we can have innovation on top of the existing digital health platforms so that patients can access these services really easily through simple to use digital services on TV, on smartphones, or on voice media through telephones, etc.
So we need to be really careful about how we implement technology, about what the values are that drive the implementation, and we mustn't forget that all implementations involve humans, and humans involved in the NHS as a system need to be well led, and leadership fundamentally is about understanding how humans operate. It's not about technology, it's actually about humans, so we just need to be careful that the humans come first.
By putting power and information in the hands of the patient, we actually change, I think, healthcare from being that 20th century model, something essentially done to passive patients, all too often very patient, by a benign health state, to modern 21st century healthcare citizens.
If we think about how people have embraced some really simple technological solutions like social media, where people have come in quite large droves to social media, it's because of the simplicity and the usability of those solutions. So I think that's the two things we need to think about when we're thinking about solutions for a mass number of individuals. However, technology shouldn't be a one-size-fits-all approach.
So part of the digital solution for me is understanding the human and making sure that people are not just treated as symptoms to be fixed or as problems to be solved by some mechanical system, but actually as people who are active participants in their health service, and digital has to start from there for me if it's really going to make a difference to people's emotional and mental health.